Hi, my name is Leah Behrens, and today I'll be presenting about expanding the role of pharmacists in chronic disease management in North Carolina. I asked the research question of how pharmacists' services can be expanded in clinical practice to fit the managed care organization model, which is what Medicaid will be transforming to starting July 1st in North Carolina. So for that, I reviewed peer-reviewed journals of randomized control groups, prospective cohort studies, pharmacist or provider-led interventions, self-reported questionnaire analysis, and retrospective chart reviews. And for those, I only looked at domestic publications because Medicaid is a domestic program to the United States. Also, I looked into different self-contained settings such as the VA, Medicaid, and Medicare to be able to connect it back to Medicaid in the end. For my results and discussion, I primarily looked at asthma and diabetes as my chronic diseases, and I looked into the asthma-friendly pharmacist model, which suggests pharmacists can educate patients on different chronic disease, their medication use, medication adherence, daily regimen, how they're using their inhalation techniques for their bronchodilators, also developing an action plan if there are some exacerbations, providing counseling or referrals for health risk factors, so someone that is a smoker could get referred to a smoking cessation program, and strengthening the relationship between a patient, pharmacist, and their local PCP. Moving on to diabetes. Pharmacists wanted to provide services as well as products to these patients. So some products that can be provided to diabetic patients would be prescriptions, glucose meters, testing strips, needles and swabs, and dietary supplements that they might be missing from their normal diet. And along with these products, they wanted to provide services that go along with them, and that includes a medication review, vaccination, unit dose dispensing, needle exchange, point of care testing, and disposal of unwanted needles and strips. So kind of combining the products they can provide as well as the services together. Alrighty, moving on to the conclusion. With NC Medicaid transformation happening so soon, they want to push for pharmacists to be able to be more involved in the community and take on these different roles they normally wouldn't be used to doing. And since there's so much change going on, pharmacists believe that if there's a time for them to change, it would be during this Medicaid transformation. And just kind of going over the respective state protocol for what they are allowed to do, because in North Carolina, they are not considered primary care providers. Also, assessing that there is a correlation between the chronic disease prevalence and social economic status. So that would go along with why Medicaid patients should be looked at a little more intensely and should be outreached to a little bit more. And lastly, for pharmacist-led interventions to be developed further, there needs to be a lot more training and accreditation. Thank you.